So, Dr. Middleton is an associate professor at the University of Louisville Kent School of Social Work and is the director of the U of L Human Trafficking Research Initiative. She has considerable expertise in leading child welfare research and evaluation projects. Her substantive area of research is trauma-informed child welfare and forensic social work, with special emphasis placed on enhancing organizational health and translational leadership as it relates to vicarious trauma and job retention. Dr. Middleton currently serves as the lead researcher for a 5-year, $5 million SAMHSA grant, which utilizes a trauma resilience framework to address the impact of community violence and racial trauma on youth and their families in West and South Louisville. Dr. Middleton is an active member of numerous local, state, national, and international human trafficking initiatives and is fully trained in the sanctuary model. Prior to making the move to academia, Dr. Middleton worked as a forensic social worker with sexually exploited and trafficked children and youth for over 10 years in Colorado. So thank you so much for being with us today. And without further ado, we'll move forward.
Great, thank you. Thanks for that introduction. I appreciate it. And I will begin our presentation. Okay. So it's my pleasure to be here and be speaking with all of you this afternoon. I realize that you have been listening to and really talking about and thinking about various forms of child abuse and responses to child abuse, which makes for a long day. So I just wanted to pause and acknowledge that we're going to talk about a form of child abuse which really takes us into the deep end of trauma. So I just want to acknowledge that before we jump in, and also say that, you know, from a research standpoint, we're really excited to have some data that we can report on from Kentucky that will hopefully help us begin to better understand child trafficking, particularly when families are actually the traffickers, which is something that I know can be really hard for us to wrap our minds around. So this definitely was a team effort. Everything that I'll be talking about today is research-based, and most of the research comes from both of these teams, Project Pivot and Project STAR, which is out of the Human Trafficking Research Initiative, and we work with a lot of researchers across campus here at U of L, as well as graduate students do a lot of the heavy lifting behind the scenes. We also had the good fortune to receive a grant for Project Pivot, which is the grant that really explores 5 years worth of child trafficking data in the DCVS database. And that grant came from the Kentucky Children's Justice Act Task Force. And we also worked in partnership with, at the time, Attorney General Andy Beshear, who's now our governor, and several other partners within DCVS. My plan for the next 40 minutes or so is to briefly touch on some key definitions within the realm of child trafficking, discuss some of the current research that we know about human trafficking and in particular child trafficking in Kentucky, and then really dive into Project Pivot, which focuses on there are 3 different aims of Project Pivot, but we're going to focus on aim 1, which was examining comprehensively over 600 cases of child trafficking that had been reported to DCVS over a 5-year period. So within that data, we're going to then dive a little bit deeper into what we were able to discern about cases that involved trafficking when the trafficker was actually a family member, and then hopefully have some time for some questions and discussion. So this first image that you see here actually comes from Project STAR. STAR stands for Survivors of Trafficking, Creating Art, Agency, and Resilience. And this was a qualitative research study that we conducted with survivors of childhood sex trafficking in West Louisville. Over the course of about a 2-year period, we conducted photo voice groups with them. So all photos and quotes come from the survivors of childhood sex trafficking. And what I will say is that among the survivors that we spoke with and interviewed and participated in the photo voice groups, the majority of them were initially trafficked by family members. So that at that point when we were conducting Project STAR, we also had some clues pointing us in the direction of wanting to really understand better this role that families were playing in trafficking. And so here, this young person, she reported that she actually found this Barbie doll displayed just as it is here. She said she did not position the doll in any different way than how she found it. And her quote is in response to the question of, what made you take this photo, or why did you take this photo? What message did it convey to you? And what would you like people to know? And so you can see her quote there is very striking. And she says it's how she feels internally, a pretty girl used and abused. So when I think about child trafficking, it brings me back to my years working as a forensic interviewer. And oftentimes, and this was several years ago in Colorado when I was in practice as a forensic interviewer for about the last 7 years of my practice career before I went back to get my PhD. When I think about those cases, at the time, we didn't identify them as child trafficking or human trafficking or commercial sexual exploitation of children, or CSEC. We actually would just refer to them as another form of child sexual abuse. And oftentimes, to describe what was happening, because it was familial, to describe what was happening, we would say something like, oh, the mom was pimping out her child. And that would be how we would describe the case. So we've come a long way. That was in the late 90s, early 2000s. We've come a long way in the last 20 years to really better understand this exploitive phenomenon in the United States. And so I'll lead you through some of that. But I have this memory, and this really ties back to how we'll end our discussion today, of a young girl who was 12 when she came to me to be interviewed. And it was actually her fourth trial that she was in because her mom had been selling her for sex. And this was in Denver, Colorado. The fourth buyer, or John, that had purchased her, that was being prosecuted, was actually an attorney and had fled the country for a little while. They extradited him back from Costa Rica. And by the time she's in this fourth trial and all of these other things had happened, she was suffering from enuresis and encopresis and had severe trauma and could not testify on the stand. So the judge at the time, in the jurisdiction that we were in, allowed her to, instead of testifying on the stand with the perpetrator right there about 6 feet away from her, he allowed her to be interviewed in our child advocacy center. And so when I conducted the interview with her, I had a microphone in my ear, and the prosecutor and the defense attorney were both giving me questions to ask her. And so when she came in for the interview, she knew that he was there and he was upstairs watching along with the attorneys. And she also knew that this was the last time she was going to have to testify. So when we went through the interview, she shared her experiences. And then at the end of the interview, I told her that I didn't have any more questions for her. And she said, she asked me, she said, "Are we all done?" And I said, "Yep, we're all done." And she said, "Well, today is the day." And I wasn't sure where she was going with that. And so I just kind of sat there for a minute. And then she stood up and she looked right at the camera, which was in the corner of the room. And she said, "Today is the day that I stop being a victim and I start being a survivor." And with that, she put her hands on her hips and she just walked right out of that room. And a couple years later, I found out she had been adopted by the foster parents she was in their care through all of those trials, and went on to be a pretty incredible woman. And so when you think about the potential impact of child trafficking on the children, I keep that memory in my mind as I'm doing this work, because I also think, in addition to what we are examining from a research standpoint and really asking what's happened, that kind of what's happened question, and we look at the trauma or the ACEs, the adverse childhood experiences, and all of those pieces, it's really important for us also to really think about what is strong in these children, and have that lens intact as we're going through and doing this research and considering our findings from this research. I just wanted to share that story with you. Okay. So you're probably familiar with many of these definitions, particularly around human trafficking and the differences between labor and sex trafficking. The three definitions I just really want to kind of pull your attention to are in the bottom left gray circle. When in this presentation, when I refer to substantiated cases, what I'm meaning by that are those are cases of child trafficking that were confirmed through a DCVS investigation, so through a child welfare investigation here in the state of Kentucky. And if I refer to cases as being founded, then those are cases that were confirmed by law enforcement investigations. So those are two different types of findings in cases that we're able to track over a 5-year period. In some cases, the child trafficking cases will be substantiated and founded, but that's not always the case. So I'll try to distinguish when that happens. The other term I really just want to draw your attention to is the bottom right-hand light blue circle, family controlled trafficking. You'll see there that our definition states that it encompasses the wider range of experiences of human trafficking survivors whose families were involved in their exploitation. So we actually get that definition and that term from a survivor leader themselves, Katie Roche. Some of you may have heard Katie speak. They are a national speaker oftentimes about child trafficking because that was their experience. And in talking with Katie, I noticed that Katie used this term family controlled trafficking instead of what we often used in child welfare previously, which is familial trafficking. So it's a term now that we've adopted and we'll continue to use that for the rest of our discussion today. And it's actually a term now that we've published. And when we published it in our most recent article, we cited Katie because for a lot of our work too, I think it's really important to center that work as much as we can around the voices of the survivors, even when we're looking at statistics. We don't want to forget where this is all coming from and who's being impacted the most. Okay, so what do we already know about human trafficking? Some of this may also look familiar. A lot of these risk factors may. This is what we know nationally, that victims are becoming younger, primarily women and girls are being included as victims, although it's not only women and girls. System involvement is a risk factor, and various forms of adverse childhood experiences put young people at risk. Now, those that are circled are very specific to risk factors that we have found here in Kentucky and or the Kentuckiana region, because one of our studies includes Southern Indiana as well, to be the case for our child trafficking survivors. So again, having those risk factors that increase vulnerability, such as some different forms of adverse childhood experiences, as well as being termed runaway or experiencing homelessness, being LGBTQ+, substance abuse, poverty, and then also any type of system involvement, particularly child welfare involvement, we've noted as a risk factor. So there are some additional pieces that put children at risk when we look geographically at where we're located. We are in a state, and particularly in Louisville. Louisville has the highest number of child trafficking reports in the state every year since we've been counting. And when we look geographically, we are a state that has some pretty significant intersecting interstates and highways. We also have pretty large scale, typically pre-COVID, pretty large scale events, sporting events, the Kentucky Derby, other types of just big events that occur in our event centers here in the city that draw a lot of people. And so due in part also to all of those environmental factors, that context also actually sets us up to have pretty high rates of child trafficking. But when I first moved here 5 years ago, no one really knew what the prevalence rate was. We just knew that we were seeing victims in the ER. We were seeing victims coming in to receive care in human trafficking programming, but we didn't really have any hard and fast numbers. So here's another photo that was taken by a survivor that I think speaks to one of the typologies of a trafficking experience, and this is also a survivor of childhood sex trafficking from here in Louisville. And she says, any person can be quickly transported without being seen. The isolation from society makes it a reality, and the farther you look, the more narrow the view. And you can really see that she captured that in this in this photo that she took. And I will tell you, in working with the survivors, that they are, in addition to being incredibly resilient, some of the most resilient and strong people I've ever met, they are also incredible artists and poets and spoken word artists. So I'm happy to and honored to be able to share some of their photos today. The additional photos from the full project actually can be found in our Project Star silent film, and that's something that we share with professional organizations and has been shared across the nation, and we showed it in Italy even at an international conference to help create awareness about childhood trafficking in the United States. So if that's ever something that you're interested in using, I know other programs have shown that film as part of a training to help create awareness and really house the information within the voices of the survivors. Okay, so as I mentioned, when I came here 5 years ago, we didn't really have any statistics on trafficking among young people. We knew from previous literature that young people are at high risk, as well as young people who are experiencing homelessness and homelessness in general. The lack of safe and stable housing can really make someone vulnerable to a trafficker. So we conducted a study in 2016 where we surveyed 132 youth experiencing homelessness ranging from 12 years old to 25. We found them at various shelters and homeless surveying agencies in Louisville and Southern Indiana. And we found one of the highest rates of prevalence actually in the nation of any study of this type. We found that 42% of them reported that they had been sex trafficked. And we identified them as being trafficked, and we operationalized that if they responded yes to any of these three questions that you see on the slide. And so this is really based on the federal law and definition of sex trafficking, regardless of age. So this is a very high threshold. I believe in New York, in a similar type of study, they found prevalence rates of between 22 to 28%. In New Orleans, 28 to 30. And then in Arizona State, or in Arizona, at Arizona State University, when they conducted the study using the same survey that we used, it's called the YES survey, the Youth Experiences Survey, they found rates ranging between 30 to 36%. So this rate and the fact that it was occurring among young people who were homeless was really a call to action to our community, particularly the community that was serving homeless young people in many ways. One, they weren't aware that this was happening so frequently among the young people they were serving. And so we worked with them to develop screening and identification protocols so that we could get them more quickly into trauma-informed services. And also, just from a resource standpoint, having this information helped them to develop grant proposals that then allowed them to bring in some additional funding and resources to better address the issue or begin to address the issue across the community. So within that same study, which we call the YES study, what really that 42% looks like is that 1 out of every females and 1 out of every 3 males was reporting that they had been sex trafficked. Their average age of their first sex trafficking experience was about 16 years old, which is actually more common than what you see in some of the previously published national data that will say 12 to 13. And we'll talk about that in a minute, why we're seeing that. But in Arizona, using the same study, their average age is similar to ours. 76% of the young people who said they were being sex trafficked or had been sex trafficked said that they were able to actually identify a trafficker. So keep in mind, per the federal and state definition, if a person is under the age of 18, so if they're a minor, there does not have to be an identified trafficker involved. Commercial sexual exploitation in and of itself is considered human trafficking and is against the law with children. About a third reported that they were actually being sex trafficked at the time of the survey. So that means while they were receiving services, there might have been someone waiting outside for them that was the trafficker, and that was happening during that day that they were taking the survey. They reported being trafficked for money. A place to stay was a really close second. So this was really another call to action. Imagine if we could shelter these young people, we would be removing that vulnerability immediately. And then also for drugs, kind of as a near third reason. And then 70% reported that technology was used in their sex trafficking situations. Primarily, various forms of social media were reported. And so technology was used 3 different ways. 1, to recruit them, 2, to keep them in the trafficking situation, and then 3rd, as a way to trade them for money. And I know that Lieutenant Bowling talked quite a bit this morning about the role of technology in trafficking and exploitation. And as we'll learn in a minute, there are some different typologies, but technology definitely plays a significant role. And in our Yes Study report, which is posted on our webpage, we have the full breakdown of all the different apps and forms of technology that were used. So we also asked about ACEs, or adverse childhood experiences, and I know you just talked about that in the last presentation. So among those who reported being sex trafficked, those who were trafficked were 4 times more likely, those who experienced sexual abuse in childhood were 4 times more likely to be trafficked. So these are really risk factors for trafficking. They were 3.2 times more likely to experience sex trafficking if they had witnessed domestic abuse of their mom. Emotional abuse and physical neglect also were potential risk factors. So these 4 ACEs out of the category of 10 were statistically significantly shown to predict the likelihood that someone would be sex trafficked. That is information that we included in the tip sheets that we developed for DCBS, because this is really a cluster of risk factors when we're looking at ACEs that we really need to pay attention to, because we see this come up again and again, even when we're looking qualitatively at data with child trafficking, and in particular with family control trafficking. Suicide risk was also found to be much higher among those who were reporting that they had been sex trafficked. So you can see here that they were, those who were sex trafficked were 4 times more likely to report suicidal ideation, 5 times more likely to actually have an attempt. Suicidal ideation was actually linked to technology when it was used for recruitment, and the involvement of technology was associated with a 7.25 higher odds ratio of experiencing suicidal ideation. So the consequences, the impact of trafficking of our young people in our community has some pretty serious long-term effects, and actually can be fatal. Okay, so that was data from the Yes study. And now kind of fast forwarding from that study, again, the 42% prevalence rate was really eye-opening for us and for the community, and really across the state, and garnered some attention from, at the time, our Attorney General, Andy Beshear, who was wanting to address human trafficking as one of his really kind of 3 areas that he was focusing on. So we were fortunate to receive a grant to conduct Project Pivot. And so here's the team, again, consists of several members from DCBS who were just really wonderful partners with us, opening up and sharing their database and giving us really everything we needed. And then, of course, our partners at U of L and our partners at that time, the Attorney General's office. So Project Pivot. Pivot stands for Prevention and Intervention of Victims of Trafficking. There were 3 aims, which are shown here on the slide. I'm only going to talk about the data from aim 2. What I will say is the data from AIM, sorry, I'm talking about the AIM 1, but what I wanted to say is the data that we've collected for AIM 2 that really looks at screening and identification tools and protocols across the nation, that has, I think, some additional relevance to the work that you're doing. And we are working on publishing that article, I think next month or in January it should be published, and we'll share that link on our webpage. But I think that might be of interest to you as well. But with AIM 1, that is really the aim that focused on looking at those 698 child trafficking cases that had been reported to the Department of Community-Based Services between 2013 and 2018. So that's that 5-year period that we're talking about. So it's this comprehensive case review that we conducted. And as you can see here, the data at the top, and we just published all of this descriptive data. So I included that citation below. And if you're interested, the full report will be released in January during Human Trafficking Awareness Month. The first figure shows the descriptive stats for those cases that were actually substantiated and or founded. So it was shown that child trafficking did occur through a child welfare investigation and or a law enforcement investigation. So out of that 698, 210 of them were actually found to have to be child trafficking. The range of ages of victims was 2 weeks to 17 years old. The mode, or the most commonly reported age, was 16 years. The majority of them were trafficked for sex versus labor, which is not uncommon because labor trafficking is even more challenging to identify and screen for. And interestingly, about half of the victims were actually at home, residing at home, when allegations were received. The majority were female, and this number here, kind of in the middle, the 89% had prior involvement with DCBS. So that also has implications for how we're thinking about and how we have developed some tip sheets and recommendations for protocols for DCBS, because they oftentimes may have the information that we need about those 4 ACEs that are risk factors, and additional contextual information that could help either with prevention or early intervention around these cases. Okay, so I'm going to jump forward, and we looked at some clustering. So at the top, you'll see that the substantiated and founded cases, again, that 210 were confirmed, and those were confirmed through founded or substantiation, that the odds of them being founded or substantiated was 4.7 times greater for cases in which law enforcement was involved versus not involved. That's not necessarily surprising. 2.7 times greater for cases involving a forensic interview than for cases without a forensic interview. Definitely has some implications, I think, for our child advocacy centers here in Kentucky. And then 1.6 times greater for cases involving drugs than cases not involving drugs. Then these bottom 4 clusters are really interesting, and we're going to focus more on the family member piece in the next several slides. So I'm going to kind of call your attention there a bit more. But we did notice some clustering around drug involvement and the role that drugs played in these cases, which is not a surprise, but is an additional environmental risk factor, which would also help to explain why our rates are so much higher than some other areas of the country. Also being younger, if the victims were younger in age, they were more likely then to have more perpetrators and also have family involvement in their trafficking. So let's kind of dive into one more piece, and then we'll go into the family control trafficking. So another area that was really of interest to the focus groups that we conducted. So AIM 3 involved focus groups with all of the different work groups of the statewide human trafficking task force here in Kentucky. So all the members were in different work groups, and we focus grouped them twice, at the beginning and then at the end of the study, giving them data as we were able to collect it. And so young people running away or going missing they were 8.4 times more likely for females than males. And in general, homelessness and runaway status is of great importance. I apologize, my dogs are probably barking at the male person. Was of great importance and interest to the work groups because law enforcement identified that there was not really a good protocol in place a few years back, and this was all part of discussion of the statewide task force, for what to do when young people were reported as missing or runaway. Perhaps a bolo might come out, but nothing else would happen unless they happened upon the young person because they were allegedly involved in illegal activity. But there really wasn't a lot of searching happening. So since then, they've been working on that because we know that running away within 72 hours of being on the street and being away from your home, you're at very high risk for being recruited or groomed or picked up by a potential trafficker. The other trends we noticed were that law enforcement was involved more in recent cases. So there's a trend of their involvement increasing over that 5-year period, which is excellent. And in line with some of the policy changes and some of the training that has occurred. And then also we're noticing increases in reports or referrals. So based on those 698 reported cases, we notice increases, particularly among professionals, which is important to note. So we think some of that is due to training and some general community awareness building efforts that happened throughout the state due to a large grant that was received at the time by the Attorney General's office. Okay, so this is really then diving into our family controlled trafficking analyses. Everything that I showed you prior was, for the most part, univariate or descriptive data and some low-level bivariate analyses. We also conducted multivariate analyses on the data once we identified that there was this really interesting piece that was coming up around family controlled trafficking, in that not half, but almost half of the child trafficking cases, the perpetrator was a family member. We even had data down to the detail of who that family member was, not their name, but their role. And so when you hear that over 40% of child trafficking cases in Kentucky were perpetrated by a family member, that's really hard, I think, to wrap our minds around. And so we might go to thinking that perhaps that is maybe a distant relative or a step parent or an uncle or an aunt. And actually, while sometimes that was the case, in the majority of the family controlled trafficking cases, it was actually a biological parent who was selling that child. So we, for many of those reasons, wanted to dive into this data. And when we ran our logistic regressions, here's some of what we found. The mean age for victims was significantly lower, about 13 years old was the average, in cases involving a family member perpetrator compared to those who were third party or non-relatives, and that average was 15 years. So about a 2-year average age difference. So younger kids are being trafficked by family members. The community type was also statistically significant in our model. So a significantly higher percentage of cases with family member perpetrators or family controlled trafficking were in rural communities, so about 80%, than cases with non-relative perpetrators. So alleged victims living in rural counties or counties had greater odds of having a family member perpetrator. So also important information for us to really think about what that means. And then multiple perpetrators was the other variable that was statistically significant in our model. So cases involving family controlled trafficking had a higher average number of perpetrators compared to cases with non-relative perpetrators. So when you think about what that means for the experience of the child and the potential impact and negative consequences, we think that that really exponentially increases the likelihood that severe trauma may occur to that child. Okay. So when we looked then, we ran another logistic regression model, and we looked at case factors and system responses to family control trafficking. And so here were 3 areas that were found to be statistically significant in the model. So nearly half of the cases with non-relative perpetrators, so third-party cases, were referred by a professional, compared to only 24% of cases with family member perpetrators. And so conversely, nearly 1/4 of cases, so about 25% of family control trafficking cases, were reported to DCBS by an anonymous person, compared to only about 6% of those involving third-party perpetrators. So some really interesting ways, and when we think about creating awareness and who to target when we're creating community awareness, some really interesting, I think, pieces of information there when we're looking at addressing family control trafficking. And then lastly, and this is arguably one of the more concerning findings, significantly more cases with non-relative perpetrators had a case outcome of substantiation or founding when compared to cases with family member perpetrators. So third-party trafficking cases with kids were more likely to be founded or substantiated compared to family-controlled trafficking cases. Okay, so and we're gonna I'm gonna wrap up here in a minute because I want to see if we have some questions, but let's think about for a minute what implications are. And we're really, there's another researcher in Kentucky who has done some research also that has brought out that the intent wasn't to look at family controlled trafficking, but through the data that they analyzed through juvenile justice, as a study in the juvenile justice system, they also had some really interesting findings and important findings around family controlled trafficking. And that's Dr. Jennifer Cole, who we actually brought on board to work with us on these more detailed multiple regression analyses. And the rate that she found in her study looking in the juvenile justice system was somewhat similar to ours. It will range between 40% to about 50% of all child trafficking cases involve a parent or a relative trafficking them. And so that has a lot of implications for us. What I also just want to say is there are probably only 5 researchers in the country that have this level of data right now around family controlled trafficking. So I want to give you this caveat that this is really an emerging area of research for many reasons. So we're really on the front end, and a lot of this, the initial study very much was more exploratory in nature. And so we're now getting ready to explore some additional research questions and create design some new studies so we can better understand this experience. So when you look at these implications, just a couple of things I wanted to point out. The first is we have this implication, I think, of just increasing awareness and education, because some of this might have even been new information to you, I'm not sure, but definitely is surprising to kind of our general community. And increasing awareness, when we think about why do we want to pay attention to specifically family controlled trafficking, well, it accounts for over 40% of our child trafficking cases here in Kentucky. And the potential impact on the child. We know that the one consistent protective factor against child trafficking and to mitigate the severe negative consequences is a supportive interpersonal relationship. But when you think about the fact that in a family controlled trafficking situation, oftentimes the person or people that could be in that role to provide that supportive relationship are actually causing the most harm to the child, that could potentially have even more significant outcomes for that child from a behavioral health standpoint in particular. Another implication, early identification is key. So, and of course, prevention is even better. And with some of this data, we think, we did use it to develop tip sheets for our DCBS caseworkers, because I think as first responders, they may be privy to a lot of these risk factors and be able to do some prevention or early intervention work. But we would say that really tip sheets, kind of like the ones we developed, and also screening and identification protocols should really be informed by current research, because again, we're really on the front end and learning more about this. So particularly if we even have research in our state that can help to contribute to the development of our protocols. So really thinking through what kinds of questions we're asking, and using that information, such as the risk factors, the 4 ACEs that I mentioned, including those and thinking about those as potential clusters, and the awareness of the other cluster factors associated with family control trafficking, such as younger age, community type being rural, and then the potential impact of having a number of perpetrators. In addition, those cluster factors could be used to design and implement prevention programming as well. And then the last piece has some policy implications, I would say, too, but really looking at accountability for traffickers, holding family members who are traffickers accountable. So in our study, we found that significantly more cases with non-relative perpetrators had substantiated or founded outcomes versus those who were family members. And our focus groups with the statewide human trafficking task force experts also indicated that they had experienced that in cases that involve family members as the perpetrator in trafficking of children, they were less likely to have charges of any nature, or the types of charges were reduced to perhaps sexual abuse. And there is a lot that can be lost in not holding those individuals accountable, just as accountable as a third party. And in addition, for all of the obvious reasons, also, there are resources actually that come through victims' compensation funds when charges are filed to help with behavioral health services and other support services for the child and the non-offending family members. And so those are often lost. So I'm going to move forward to just one more slide and stop there because I know we're almost out of time. And I wanted to just show this slide because this was also an image taken by a survivor and a quote from her. She had taken this picture of this trash can in an alley, and what drew her to it was this plant that was flourishing inside this container. She said it was flourishing, progressing inside a container we put waste inside of, and that it is beautiful to me, like my growth. So while I know I was delivering a lot of bad news in some of this data, and also speaking in terms of statistics and numbers, I really just wanted to bring it back to the just incredible transformational meaning that survivors of childhood trafficking can have, and really the messages that they can share to us and how important those are to think about when we're thinking about doing this work. Okay, so I'm just going to stop there and stop sharing and see if we have any questions.
I think we're really limited on time, but I will just relay, maybe you can really quickly, the question, how can we detect trafficking in our patients? What questions should we ask? Or if you have a resource to look for that information, because I know that topic is, that's a lot.
It is a lot. It is a lot. And like I said, we're working on a second publication for that piece of the project. What I would say is that if you are able to access the DCBS tip sheets, we compiled all of those risk factors and indicators on that sheet based on this research. So those 4 ACEs, as well as some of those other contextual pieces that I just talked about. And if you want, I could also send those to you, the electronic version to you. Would that be helpful? And you could share them with the group later?
I think that would be great. Yeah, or if you come up with the link to the sheet or the tip sheets in particular, if you want to put them in the chat, that way everyone could